Before we begin, a quick disclosure. This podcast is sponsored by Innovative Hematology Incorporated, a leader in blood disorder care, education, and clinical research. Innovative Hematology may have direct or indirect financial relationships with some of the organizations, products, or companies discussed. Full disclosure and details can be found in the episode show notes. Welcome to We Bleed Too, where women's health meets real talk, real care, and real expertise. Hello, everyone, and welcome to We Bleed Too. My name is Magdalena Lewandowska, and I'm joined by Hilary Gaudreau and Janey VanLiew.
The unique thing about our podcast is that we have different perspectives from a hematologist, an obstetrician, and from a registered nurse.
Yeah, I could talk iron deficiency anemia all day long.
Let's iron it out.
Let's iron it out. I love it. I love it. I love it.
About like treatment for somebody who maybe their iron levels are low. Like, can you eat an iron-rich diet and it correct it? Because, a lot of people are like, I don't want to take more medication than I need to, or they want to do things more naturally.
We have a handout that we do give our patients, which we can provide a link to, that focuses on iron-rich foods. That being said, when someone's truly iron deficient, and it's because of difficulties with absorption or because of blood loss that's significant, I've never been fully successful in just getting rid of that or fixing that with food itself. Okay, so absolutely, for someone who's otherwise healthy and maybe a little low on iron, increasing the amount of iron-rich foods in their diet can be helpful. That's never the wrong answer. And regardless, we still provide patients with this as a supplement, right? But on top of that, if somebody truly has severe iron deficiency or an iron deficiency anemia, we usually have to replete it. And the easiest way for people who can tolerate it and do well is oral formulations. Now, the downside with oral formulations is, one, not everybody absorbs it the same way. And it has a lot to do with sometimes other inflammatory conditions in the body. Sometimes, for example, like thyroid issues can lower how well people absorb, or if they've ever had bariatric surgery, or if their stomach is not acidic enough. And there's a kind of a laundry list of things that can affect your absorption. And so, that's one thing, that it may not work necessarily. You also can't take it around the same time as any kind of dairy products or caffeine or theophylline, because that reduces absorption, and then you're just taking it for fun. But there's a lot of side effects that are real with oral iron. And I have to tell you, I remember being started on oral iron during a pregnancy, and I remember going running after and just feeling this horrible contraction of my stomach. And I felt like the way I imagine peptic ulcer disease must feel. And then it really helped me understand and empathize with all the patients that we had prescribed iron to that could not tolerate it. And so not all iron formulations are exactly the same, and some are better tolerated than others from a GI perspective. Most of them, or pretty much all of them, cause some degree of constipation, and there's some variability. And they can cause a little bit of this kind of iron taste also, that's kind of like an aftertaste in people's mouths. So not everybody tolerates it. The other piece is how often we take it matters. Back when I was in training, we used to give it to people, which seems really mean now. We used to give it 3 times a day. That was the general teaching, right? That you have to give it really, really often for people to absorb it, to really correct their anemia. But little did we know that by doing that, we raise the inflammatory protein hepcidin. And so the higher that is, the body has a natural protective mechanism to not absorb too much iron. Because on the other end of the spectrum, too much iron can lead to accumulation of iron in places it shouldn't be, like the heart, the liver, things like that. So you want really a balance. We have this therapeutic window, which is you need enough iron, but you don't want too much, right? And so the body's really good at protecting you from absorbing it. But unfortunately, when we're treating iron deficiency anemia, that can get in the way.
That's so interesting. Yeah. So in an attempt to get more iron in someone's body, get them to absorb more, we're effectively reducing the ability to have their body absorb iron, but we're giving them all the negative side effects.
100% true. So nowadays, what we do is we usually recommend, first of all, there's no reason to be taking it more than 1 time a day. But there's some data to suggest that actually dosing every other day can help with absorption. So I do usually talk to my patients about both of those options. Sometimes taking it with a little vitamin C can be helpful.
You mentioned something about the acidity. And so I hear frequently people say to take it with orange juice or something like that, that helps with the absorption.
Yeah, potentially. I mean, there's actually even some tablets, some chewables now that are over the counter that have vitamin C in them. So you can do that. There are certain formulations that certain people seem to do a little bit better with. That being said, not everybody does well with oral iron. And so normally we actually will repeat a level a couple of months into therapy. And then, that's the other part that's important. Just because you're iron deficient, it doesn't mean, you start an oral iron and we'll see you later, follow up in a year, right? We really need to be following these levels and making sure that people are absorbing properly and checking in with patients to make sure that they're not having significant side effects with the iron.
How long does that take, do you think, before you start really seeing a difference in somebody with taking oral iron?
With oral iron, it takes about 2 to 3 months to see effects. And we see the effects faster with IV iron within about a month.
And what I understand is that there are no barriers to absorption with IV iron.
Yes.
Versus when we're putting it in our GI system, there are many different reasons why we may take it properly, we may take the timing and the amount, but there are barriers to absorption. So it's important to follow those numbers because we don't know if someone has barriers to absorption. If we just send them out on their iron and say, see you in a year, they may actually need intravenous or IV iron.
It's true. I mean, and there's a lot of reasons to give IV iron. Usually we start with oral because it's the least expensive and it's the easiest, and iron is over the counter. But in people where we really need to see an effect, like right now, right, like with severe iron deficiency anemia, usually we'll lean more towards giving IV iron because we know, like you said, it goes directly into your vein. It's done in a hematology clinic or an outpatient infusion center, and we kind of have different protocols based on the type of formulations that we give. So cost is one, right? Because it's the cost of the infusion, and everybody's insurance is a little different. So that's one barrier. There's a small risk of allergic reactions, and that's usually less than 1% risk. But if somebody has more than one allergy, so for 2 or more allergies to medicines, or if they've ever had like a serious allergic reaction, like anaphylaxis or, severe hives, or if they have asthma, we'll premedicate with a steroid and acetaminophen. So interestingly, Benadryl does not work very well and can mimic an infusion reaction. So that's not one that we use.
You taught me that, and I appreciated that.
Oh.
Yes, very much so, because I think most of us as healthcare providers think about Benadryl as reducing any kind of allergic response. And I find it so curious that it can mimic an allergic response. So some people who feel as though maybe they've had an allergic reaction to intravenous iron, upon further questioning, you might find that they were given Benadryl and they really didn't have an allergic reaction.
Well, what's interesting is Benadryl can cause some flushing and palpitations, which is I feel like that your heart is beating fast. And with IV iron, one of the side effects, which is not a true allergic reaction, but is a side effect from the infusion, is something called a Fishbane reaction, which is where someone can feel kind of flushed and kind of like heavy, but then their blood pressure is normal, their oxygen is normal, but it almost mimics anaphylaxis from like a patient feeling perspective. So we usually give IV steroids at that time and it kind of goes away. We usually are able to restart the infusion safe and patients do well. And there's actually videos online of what a Fishbane reaction can look like. So it's really important to be able to differentiate between those two. That being said, allergies do happen and reactions do happen, which is why it's given in a really controlled setting where, nursing staff is present at all times, and all of the medications are ready for somebody to receive in case they do have a reaction. But that, I would say that happens rarely. For the most part, we obviously, because we give so much IV iron here, see it more than most clinics, but overall, IV iron is a very safe and effective medication to give. And I think that there's a fear in the community, and it's definitely underprescribed because of the fact that it seems like such an overwhelming thing, right? And kind of like we have myths surrounding IV iron. And sometimes it is the most appropriate medication for someone to really feel better. It's one of my favorite medications to give because when it works, because really people feel so much better. And it's so wonderful to see that repletion and how, they're able to it improves their quality of life to such a great effect.
You get a lot of bang for your buck.
You do.
With that. I think of it as like watering a plant that's, so dehydrated and the dirt is just dry and cracked. We wouldn't come along and say, I'll give you a dropper, worth of water every day.
Mm-hmm.
We would say, let's really, soak your roots and get you where you need to be, because otherwise you may never get there. So with oral iron, sometimes, depending on the condition or the amount of blood loss or the barriers to absorption, a little bit of oral iron every single day for the rest of your life, that plant may not make it. So, a lot of people think about iron-rich foods in terms of red meat. And so I was just curious, what is your favorite vegan source of iron?
Oh, that's a great question. It depends on what the diet looks like. I mean, certain legumes like lentils do. Red wine is vegan as far as I know, and has some iron in it. I mean, dark chocolate sometimes has magnesium. A little bit.
I'm going to circle back to wine. Red wine. So I know that
red wine and chocolate.
Perfect. A new iron supplementation. So I know that grapes, so speaking to red wine, the darker the skin of the grape, the more iron apparently it has. Is that true?
I mean, no randomized controlled trials with all of that. So it's hard to say. And as we kind of spoke about earlier, I know one of your favorites for iron has been, I think you mentioned that you learned from a patient.
Yeah. Blackstrap molasses.
Yeah, blackstrap molasses.
Interestingly, it doesn't have a lot of iron. So I'm curious about it more and more, because I think that it may be because it's a food source, it's probably absorbed better.
Mm-hmm.
But I have to look into that. Yes, blackstrap molasses. I have a new favorite.
What is it?
Sunflower seeds.
Really?
Yes, pepitas. I don't want to rattle off any numbers because they were probably AI generated. But something like 5 milligrams per maybe half a cup or cup, which doesn't sound like a lot, but I think that when we talk about dietary sources of iron, I think the goal is not to expect people to mainline large quantities of, say, dark grapes or blackstrap molasses or
spinach.
Baby spinach. What's nice is to give people options that allow them to make informed choices when they're in the grocery store.
Well, and also, there's the iron fish that you can buy that you can boil water.
Oh, yes.
And make soups in, or cast iron, right, for cooking.
Cooking in a cast iron pan.
All of this. And it's awesome. I think I encourage all of it. And cast iron, especially the more we learn about Teflon coatings and things like that.
Exactly.
It seems like a reasonable way to go. But again, coming back to the crux of it is, if somebody truly has iron deficiency anemia, the chances of them really correcting it with
an iron fish is not going to resolve the issue.
No, but it's a good idea for people who are vegan though, right? As a supplementation.
Every little bit counts?
Yeah.
Okay.
I always think it's interesting to give the adolescents that iron-rich diet list at their visits. I'm not eating anything on that list. I'm not eating any of that. And I always tell them, there's no Doritos on the list. And so for the average person that's going to go to the store and buy their oral iron, can they just go pick any random iron off the shelf? Is there a difference in iron?
There's a couple of different irons. One of my favorites is iron polysaccharide, and there's a couple of different brand names for it. But it comes, the iron comes in its activated form, so it saves your body a small step. So it may cause slightly less constipation. But biglycinate also is very similar in that way, that it may cause a little bit less of those GI side effects. Honestly, ferrous sulfate is kind of the cheapest over-the-counter. Iron sulfate is one of the least expensive over-the-counter medications that will be available in most stores. There's some kind of delayed release irons. There's actually a heme iron too, for people who are not vegan, and heme iron may be slightly better absorbed. And there's different amounts of iron. So just because you see the milligrams on the bottle, that's not how much is actually in it in the elemental form, if that makes sense. There's other things that are in it as a compound within the iron. So for example, ferrous sulfate comes usually in 325 milligrams, but really 65 of that is elemental.
We're comparing irons, different types of irons. It's apples to oranges, but if we want to equalize them or use the same metric, it would be where you look on the bottle and it says elemental iron. Is that what you're saying?
Yeah. And I mean, there's just different amounts. And honestly, to some extent, I mean, it matters, but it doesn't, because your body only absorbs like a very small percentage of the iron that you take. So I think anything above like 20 to 30 milligrams, I mean, you're kind of in a similar boat. You're absorbing a small fraction.
So more is not necessarily better. And we know that more frequent administration is not better for a lot of reasons.
And it's quite mean, actually.
Yes. And so on social media, one of the things that's kind of popping around these days is liver capsules and beef liver as a source of iron, beef liver as a source of, glorious wellness. Do you have thoughts about, and on that disgusting food list, well, the food list with iron, there's a category of disgusting and then there's a category of tolerable. Kudos to anyone who, no offense to the people who like the ones that are on my label disgusting list. Liver is on, and I think it is the animal tissue with the highest amount of iron, gram per gram. I'm curious, do you have thoughts about people taking liver capsules?
I mean, I know that there's heme iron that's available over the counter. I'd have to take a look at the capsules. I mean, I will share, I'm Polish. It's a very classically a meat-heavy culture. And I will say, so liver, actually sauteed liver with onions is like it's a dish.
Absolutely.
One that I engage in frequently. But so, I mean, this is something that people have been doing, I think, for centuries.
Yes.
As self-remedy for iron deficiency anemia. I think, heme iron definitely absorbs well. So I'd be curious to hear more about that.
I think one of my thought processes about anything that pops up on social media and anything that falls in the category of supplement, vitamin, it's important for everyone to know that those supplements are not subject to FDA regulation. So sometimes, depending on the source and from where we're acquiring these supplements, they may not have the amount in them that is stated on the bottle, or they may have something else in them.
We should be careful with supplementation. And I think that's something we talk about a little bit more in terms of knowing what it is that you're putting in your body, right? There are some supplements that are absolutely appropriate when that element is missing. But I'm also not advocating for, if, depending on the levels, it's important to kind of know what we're doing and to be able to monitor and subsequently follow up with patients.
So I have brain fog, I'm tired, feel depressed. What about if this goes untreated, morbidity with iron deficiency?
Yeah, I mean, eventually iron deficiency does turn into iron deficiency anemia, and it can cause more and more issues. Like people can develop, palpitations, they can develop shortness of breath, difficulty exercising, for example. It can be mistaken for deconditioning. And I think the lowest hemoglobin level that I saw in a patient who walked into my clinic as opposed to being brought by ambulance was a hemoglobin of 4. So for reference, 13 is normal, right? So they were missing about 9 units of blood at that point from what a normal value would be. And this woman walked into my clinic. And if you're bleeding out over time, you almost get used to feeling not well. And you don't realize you don't feel unwell until you don't anymore. So that is part of the danger of it. So I think, keeping up with your screening, right, with your annual physicals, with your blood work, and paying attention to your body really over time, I think is really, really important, because it's always a little shocking to me that people live with such low levels of blood in their bodies. But at the same time, I do completely understand it. So be curious, I would say. Is this new? Is this different? Did I feel this way a year ago? I know I haven't been jogging every day, but I should not be getting short of breath climbing upstairs if that's not my baseline. And the same would apply, I would say, to the doctors, the healthcare professionals, is we have to stay curious about our patients and what is normal for them and what is the best modality to treat them.
Well, thank you, ladies. That's super interesting and had fun ironing out this topic.
Lots of food for thought.
Yeah.
That was my best pun.
Pun intended.
Iron-rich food for thought.